So what Sports Medicine Northwest offers in the new facility here is an awful lot. We've always prided ourselves on being the sort of team that can handle anything that doesn't need surgery. And what that means is I end up filling the role as a bit more of a point man and a quarterback. When the patient comes to me, I'm thinking about not just my skill set, but my team's combined skill set. And what we've done now with bringing in regenerative medicine into the practice here is now we've finally taken another step. We've always been able to take what you have and get the most out of it. Now we can improve what you have, what you can do with it, and now we've really taken a huge step forward in how we can help our patient population and location here. Rich Martin was the classic example of the perfect case for regenerative medicine because we were able to correct how he was able to move. The tissues that we had available were functioning correctly, but the health of them was insufficient to support his hobbies, his life, his interests. He could just sit at a desk and be okay, but he was not going to be able to get back to full functionality, not going to get back to the soccer field, not with the meniscus and the MCL healing the way that they were. And he was really stuck in a difficult spot. We're able to improve the functionality, but the joint health wasn't substantial enough to sustain the activities of high-level soccer, and surgery really isn't an option, not with this sort of presentation. The damage isn't bad enough. So with this approach, we're able to unsuck this healing presentation by reinitiating a healing process and putting stem cells in the area where before you just had a disproportionate ratio of inflammation. What we started off with was a PRP injection. We draw his own blood, 10 cc's, 10 milliliters of his own blood, spin it down in a centrifuge for 8 minutes, and that separates it into the component parts. We're able to take his own platelet-rich plasma and inject it directly back into the injury site. In this point, what we're doing is we're honoring the process of the healing phases. We've created what your body perceives as a fresh injury. Platelets only aggregate in an area like that when you have a fresh injury.
Pretty amazing. Last night was the first night in months where I woke up in the night and when I straightened out my leg, it didn't hurt. I was just shocked. I was just like, wow, like this is fast. I mean, I went to bed and it was kind of sore after the injection a little bit, but not too bad, a bit swollen. But then when I woke up in the night, it was pain-free and I'm feeling pretty good. So I really just wanted to record.
Yeah, there you go. Yeah,
thanks a lot. Hey, Michelle.
Rich is ready for a second visit. He shows back up. As that wave is breaking, this is when his body's stem cells wander up to the battlefield, as they had tried before, do an insufficient job of healing the tissues, and we reinforce with 1.5 million viable stem cells to finish the job for him. That's step 2.
I wanted to report that the knee stiffness and pain that I was experiencing for like months it's still gone. The knee is getting stronger. I'm absolutely delighted so far with the results. No adverse reactions at all. And I can finally see a way forward to getting over this injury. So thank you so much, Dr. Pond, and I really appreciate it.
Step 3, return 1 month later for a final buffer there, a bit of a bumper, a final PRP injection to get your own stem cells back online, not dependent upon the laboratory that we use here. Final phase of initiate what that perceived injury, inflammation drives down, your stem cells come over and start maintaining what we've built. Throughout that entire process, we have you on a progression for the correct rehab exercises and make sure that you're making the most of what you're gaining there.
The knee's been feeling awesome and I've been getting through PT really well. I'm going to have a test with Skylar after this final injection and then hopefully back to PT, and the end is close and I'll be playing again.
This is an exciting time for regenerative medicine, the patients who get to have access to it. Things are blowing up, there are more people offering more styles. What I expect to happen is there to be a major demarcation between quality practice of regenerative medicine and everybody else. In every decision we make, from the laboratories that we use, from the staff that we hire, from the recommendations that we make, every single part of the process, we're setting ourselves up for 5 years from now, where you have the people who've done this poorly and are giving everybody a bad name, and the people who've set the standard high. And that's what we're aiming to do right now.
So this is 11 weeks since my first stem cell injection. The last one was about 5 weeks ago, I've been in PT for the last 4 weeks. This is my first round of golf this year.